Good evening, I'm Daniel Green and I'm here to cover the special report on trypanosomiasis. Human African trypanosomiasis, also known as African sleeping sickness, is a deadly disease caused by the parasite Trypanosoma. Humans become infected with the parasite when it is injected into the human body through a bite from a tsetse fly. It causes severe fever, and in advanced stages, left untreated, it can cause death as it attacks the brain. Although it is currently not that prevalent, it still affects approximately 10,000 people in rural areas of sub-Saharan Africa. We're now going live to a village in Uganda called Tororo, where our live reporter Howard is here to tell us more.
Thank you, Dan. I'm Howard Abdurrahman and I'm here at Tororo Hospital, where there's been an outbreak of African sleeping sickness. I'm here with one of the patients named Richard Head. So, Richard, how are you feeling today?
I've got this terrible, terrible headache that just seems to be all over, and it's really, really bad. I can't sleep, and it's just affecting the back and the front of my head, and I'm in sweats breaking out, and my joints hurt. I can't really bend my knees or my elbows, and my muscles are really aching, and I keep wanting to scratch everywhere because I'm really, really itchy. I wish it would just go away.
Thank you, Richard. So here is a reconstructed video showing Richard's earlier tsetse fly attack.
What are you? Ah! We're now going to go over to our scientific correspondent, Malaria, who is going to talk us through the life cycle of the tsetse fly.
I am now going to describe the generalized life cycle of the protozoan Trypanosoma brucei. The cycle starts when a tsetse fly bites into the human host, which results in the delivery of growth-arrested metacyclic trypamastigotes. The parasites then enter the lymphatic system and pass into the bloodstream, where these trypamastigotes then differentiate into proliferating long slender forms that establish and maintain a bloodstream infection. These parasites can eventually penetrate the blood vessel endothelium and invade extravascular tissues, including the central nervous system. In the bloodstream, a quorum sensing-like mechanism elicits the differentiation of long slender forms into short stumpy forms that are cell cycle arrested and pre-adapted for survival in the tsetse fly. In the bloodstream, a quorum sensing-like mechanism elicits the differentiation of these long slender trypamastigotes into short stumpy forms that are cell cycle arrested and pre-adapted for survival in the tsetse fly. The next part of the life cycle occurs when an infected host is bitten by a tsetse fly, where parasites are taken up with the blood meal into the midgut. The short stumpy form then differentiates into procyclic trypamastigotes that resume cell division and hence establish a midgut infection. Midgut procyclic trypamastigotes then migrate through the peritrophic matrix along the foregut to the proventriculus. In the proventriculus, procyclic trypamastigotes undergo extensive restructuring, coupled with asymmetric division to generate one long epimastigote and one short epimastigote. The short form then migrates through the mouthparts and into the salivary gland, where they attach to the salivary gland epithelium. Attached epimastigotes replicate and ultimately complete the life cycle via asymmetric division to generate metacyclic trypamastigotes that are free in the salivary gland lumen and are uniquely adapted to survive in a mammalian host. These metacyclic trypamastigotes are the infected form of the protozoan and are hence responsible for the pathology of African sleeping sickness.
Thanks for that, Malaria. Just heard news just in that Richard Head's taken a turn for the worst, so we're now going live to Toronto, where we are following his doctor.
Hi Richard, I'm Dr. Dixie Morris. How can I help you today?
Where am I? Mum, go away. Oh, I don't want you here.
You're
Mum,
at Tororo Hospital.
My heart. It's beating. It feels like it's gonna explode.
Are you in a how much pain are you in on a scale of 1 to 10?
10. And here as well. What's happening to me?
Towards your groin?
Yeah.
Have you had any problems peeing?
It's really painful. And I'm shaking. I can't stop shaking.
And how long have you been like this for?
I don't know. Minutes, hours. I don't know. I'm not sure. I can't feel my legs. What's happening to my legs?
Can you feel this?
Help. No. What's happening?
What about this?
No. Go away. Stop touching me. Stop it. Go. Go.
So our patient here, Richard, has been presenting with the classical signs and symptoms of African sleeping sickness, as shown by his cardiac dysfunction, which was shown by his left-sided chest pain, and renal dysfunction, as shown by his long groin pain and his problems urinating. He's also presented with paralysis of his lower limbs, joint pain, tremors, confusion, anger, and other psychiatric symptoms.
Oh my god, there's a tsetse fly coming!
Well, that didn't go according to plan. Apparently there appears to be technical difficulties, so we're going to cover the weather. So over to you, Oswaldo.
Oh yes, that's me. Okay, I'm Oswaldo, and today I'm going to bring you the weather for this evening. So, the weather, African sleeping sickness. What initially occurred is, as the name suggests, it starts in Africa. And if we zoom into Africa, how did this disease manage to affect so much of Africa? Well, it initially started with an epidemic in 1896, where it affected Uganda and Congo, as you can see in this map here. And approximately 50% of the population of Uganda and Congo were affected by either smallpox or sleeping sickness. So this caused approximately 300,000 to 500 deaths, it's been estimated. And that was the first epidemic of the 20th century. In 1920, we then had another epidemic in West and Central Africa, which you can see in this map here. And this was partially stemmed by the DDT, which was released in the 1940s. Additionally, vector control, chemotherapy and screening also helped to decrease the rates of disease. Unfortunately, in 1960, political instability occurred, and this led to a withdrawal of health services. Additionally, there was relaxation of preventative measures, which meant in 1970, another epidemic occurred. And this occurred in the village of Torero, where our reporter was reporting from before. There was a national control program that was rolled out, as well as non-governmental organisations such as Doctors Without Borders, which targeted the most affected areas, as well as a new drug released which called L-Fornifine. This eventually helped to tackle the disease. So if we move on to today, we can see a massive downpour into the Congo and the Central African Republic, where they're reporting cases of about 1,000 every year. Chad additionally is dealing with some drizzle here from the tsetse fly, and about 500 cases are being affected every year. Additionally, Angola, as well as the Sudan region, are also seeing some migration. And if we go to Zambia and Zimbabwe, as well as the Cameroon area, we can also see a few cases, about 0 to 100 every single year. What this means is that the WHO plan to eradicate disease by 2020. And hopefully, this can occur through the use of new drugs and by continuing preventative measures. That's all from me. That's all from me from weather. Back to you in the studio, Dan.
So now we're going to go to our correspondent in infectious disease, who's going to talk us through the pathophysiology of African sleeping sickness. So over to you, Ben Dover.
The tsetse fly, infected by a single-cell parasite Trypanosoma, bites a human, and the parasite is injected into the subcutaneous tissues where it reproduces and migrates to the bloodstream. This is the start of the first or early stage known as the hemolymphatic stage. In the bloodstream, these parasites further divide and elongate. They use their long tails called flagellum to swim throughout the bloodstream. Trypanosoma are specifically designed to evade the immune system. Each trypanosoma parasite is armed with a shield of proteins. White blood cells in the blood recognize these proteins as foreign and present them to the B lymphocytes, causing clonal expansion and mass production of antibodies which attack the proteins. However, trypanosomes are able to change their surface proteins regularly because of their variant surface glycoprotein code, rendering the host's antibodies useless. This allows the trypanosomes to replicate and invade multiple host tissues, specifically the GI tract, including the esophagus and colon, and the heart, where they can cause severe tissue damage. The disease can lay dormant for an indefinite period of time before it can return into a second stage or advanced stage. This advanced stage is known as meningoencephalitic stage. Here the parasite crosses the blood-brain barrier and causes severe immune and inflammatory responses in the brain. This often leads to neurological symptoms and personality changes, such as confusion and aggression, and, if untreated, often results in death.
Thanks, Ben, for that report on the pathogenesis of African sleeping sickness. We're now going to go over to our World Health Organization correspondent, Dr. Wayne King.
Hello, I'm Dr. Wayne King from the WHO. If it's caught in stage 1, then generally the prognosis is very good. A treatment of surromin will generally lead to no side effects. Unfortunately, if it's caught in stage 2 and disease is spread to the central nervous system, then it can be fatal. A combination of milazepam and nifurtimox can, however, improve outcomes. Unfortunately, there is currently no vaccine, and this is due to the life cycle which discussed earlier. We are confident our preventive measures, however, can result in a decrease in disease and eventually lead to eradication of disease. Our preventive measures include vet control using DDT nets, game destruction, host reservoir control, and we're also trying to exterminate the male tsetse fly population. Thank you very much.
So that's the end of our special report on trypanosomiasis, African sleeping sickness. We hope you found it very informative. Good night.